in the late 40s and his early 50s, Reg was starting to have difficulties in coping really with various things, and getting sudden attacks of breathlessness, and it's not nice at all when you can't breathe. Nothing else matters, as we all know.
The reason I was diagnosed was basically I was playing softball with my wife and 2 children. We all play in the same team, and I found that I couldn't run from one base to another without stopping. Actually, on a couple of occasions, the game was stopped due to my lack of breath. I then went and visited the local doctor and was referred, and was found that I had emphysema. That was about 3 years ago, just before my 50th birthday.
I was diagnosed 14 years ago, and at that time I was told that it would probably be about a 5-year life cycle.
I was running to work in the mornings, and it's about 8.5 k's. And progressively over a couple of weeks, I went from being able to run a couple of k's at a go, because I'm not a great runner, to not even being able to run 200 metres. And it was confronting, and I'm like, well, obviously I'm just lazier than I thought. It's cold. And I kept getting a lot of little mini infections, and I'd be at the doctor saying, oh, you know, what's wrong? I can't breathe. I feel like somebody's sitting physically pushing on my chest, and I can't get any air. Feels like the air's stopping at the top of my lungs. I've got these little infections, and this went on and on and on through late July, August and September. And then in the October I went to a different doctor who then decided to test for a lung disease versus everything else.
We did the lung function test and the whole gamut, and which was useful to find out, you know, what was this. And I was given the diagnosis of chronic obstructive pulmonary disease.
I was very confused and a little, isn't this an old person's disease? Does this mean I'm going to stop breathing? Does this mean I'm going to end up like people you see that just die because their airways seal up? I wasn't sure what it was, and it was a little confronting, and it was quite frightening.
I asked what it was, and I think I remember thinking, the reality is you've smoked for all those years, you're going to pay the consequences for that.
My reaction to the diagnosis, honestly, was, what do you expect? You know, shit, but what did you expect? You've been smoking since you were 11. You're hooting down 30 odd a day, or 10,000 a year when I worked it out. What did you expect?
The symptoms were I couldn't breathe, and it's extremely fearful. If you don't know what that is and all of a sudden you can't breathe, it's a very unpleasant and quite terrifying experience. And I was actually in the middle of town in Calcutta where we were going over a bridge, and I was with a lot of other work people, a lot of engineers, with a lot of men. We were looking at things, and I got that I couldn't breathe at all, and they ran down and got the car to come up and take me back to the hotel, and a doctor came, and a doctor said asthma, and gave me the appropriate medication for asthma. But I knew when I got back to Australia that it wasn't just asthma. It certainly was asthma, but it was actually the COPD, and you cannot, when it's that bad, you're actually gasping for air.
When I was starting to get on a bit, I was starting to find it very difficult to climb up a ladder and carry a piece of timber up there and cut it or whatever. And it was starting to become frustrating. I was slowing down. So I asked my doctor. He said, oh, don't worry about it, it's just old age. It's coming. I said, oh, right. Persevered a bit longer. And then I happened to go to the doctor's another day, and it was a young lady doctor. Oh, never had a young lady doctor before. And she asked me how I felt, and I told her. And she said, I'm going to send you to the hospital and get some tests done. So she did, I went and I had this injection put in the arm, and I had to get on the treadmill and then the bike and so forth, and then go through an MRI. And then the surgeon said, "It's time for you to retire. You have emphysema." Oh. Shock, horror. How long have I got? How many cigarettes do you smoke a day? 25, 30, whatever. Well, he said, keep working, keep smoking, give you 4 years. Best kick in the butt I ever had.
Looking at the x-rays of my lungs showed me that what had been done wasn't reversible, and I had to then choose what I was going to do about it.